I want to say again, welcome. Wondrous Roots, your health from the ground up. So my name is Becky Montrone. We have a business here in Keene called Wondrous Roots. I am a certified holistic healthcare practitioner with a degree in holistic nutrition. My degree is in holistic nutrition, and my certification is through the American Association of Drugless Practitioners. And so we've been here in this spot. We're in our 12th year, and I have been in business. We've started out in 2005, started Wondrous Roots in Londonderry, New Hampshire, and we've been a few other spots along the way. So here we are. I'm glad to have you with me. So again, we are open here at 9:30 to 5, Monday through Friday. Our number is 603-439-2603. And you can also reach out to me from either of our websites, shopwondrousroots.com or wondrousroots.org, and go to contact us. And there you can just send me a message and I will get back to you. It will come to my private email. And I see Raymond made it on. Good, Raymond. There was a little confusion there at the beginning. And I was like, oh my gosh, it said Raymond will not be able to join again, but he's there. So I'm glad to know that. I'm breathing easier, Raymond, knowing that you're there. I think everybody can hear me. As last week, those of you who are with me know, I had a microphone problem. My microphone was not being recognized. So I did, uninstall and reinstall and do all that stuff. Technology is wonderful. I love its benefits much more than its pains, its aggravations. But anyway, people are still coming into the room, so I don't mind just gabbing away a little bit. Last week, I talked about rebounding on a mini trampoline for your health, a practice I do every single morning. The only way I get it done, I promise you, is to do it as soon as I get up. I get up, I use the bathroom, I put my indium on my tongue, and I go straight to the trampoline. If I were to delay, I would not get back to it because there's too many things for me to choose from that I want to do before I get to work in the morning. So that works for me. 10, 15 minutes, boom, done, do some stretching. I'm out of there. It's all great. I'm off the trampoline. So then there's the next thing I do after I do that. And that is I take my serapeptase and then I put coconut oil in my mouth and I begin to swish, and I swish for about 15 or 20 minutes while I am doing all kinds of other things like making the bed, picking out my clothes, you name it, getting food ready for the day, that kind of thing. So it's the reason I say that is I'm not like trying to sound like, oh, wow, Becky, you're just so great and disciplined. It's just that I know how it is to be busy. And if I don't make sure that I do these things, I won't do them because there's always something else to do. So that's how I do it. I don't just, hang around in the bathroom with coconut oil in my mouth and waste that time. So you can do it while you're doing other stuff. I've even done it in the shower. And my daughter said, how can you do that in the shower? Because you can't open your mouth. Well, you just breathe through your nose. And luckily I'm a person who can breathe through my nose and remember not. The bad thing would be if I had to sneeze while I was in the shower, because that wouldn't work out well. But in any case, so that's what I'm talking about today is the oil pulling. And if you're on and you're my guest right now, then you have seen that in the newsletter. I will be putting out an email again later this afternoon with the recording of this one and from last week, because I never went back and edited that all out and dealt with it. So I'll do that later today. But that one was really important. If you missed it on rebounding exercise is the most efficient. It is amazing for what you get for your time. I started out last week saying how you to burn 150 calories. This example was given in a book that I read. You bounce for 2 minutes, or you run for 6 minutes, or you swim for 10 minutes, or you walk for 20 minutes. That's just calorie burning. But that's not why I rebound. And there have been other benefits are just amazing. So again, I'll be getting that video out later today. So I'm going to dive right in. I'm probably going to share my screen, some of these things I'm looking at, because it's really ridiculous for me to read to you and just be sitting here having you like stare at me while I'm reading. So, and it can be helpful. So, and then these things too, you can go back to. If you are listening on Zoom or on Rumble and you do not get my newsletter, you will see in the description of each video a link to the newsletter. And the newsletter will then have all this information that I present, right? So then you can go later and you can enjoy digging deeper. And there are always within things that I put in there, there's always, as you know, hyperlinks to other things. And so if you're interested in a topic, you can kind of run with it. I will caution you. I will say in the last 4 months, let me talk, just give another instruction. Okay. If you want to speak audibly, just raise your hand and I'll call on you and you can do that. If you would like to participate and not speak audibly, you can type into the chat or the Q&A. And we can all participate that way. And oftentimes you guys do, and I like that. Okay, so so what else was I going to say? Oh, yes. So there you can see that information. You can also then subscribe. So up in the top of a newsletter, and I guess what I'll do is I just share my screen for the moment. Let me see where my screen is and go to what I want there. Yeah. Let's see. All right, now come back here. Hopefully we will be free of technical difficulties today. There we go. Share my screen. So here I say, just swish. You know that, the David Bowie, just dance, dun, dun, put on, dun, just dance. So last week I thought, just bounce, right? Just bounce. And that would be a good song actually to bounce to if you bounce to music. But today it's going to be just swish. And we could say just pull, but I'm going to say just swish. But the thing is, dental health is so much more important than just your teeth. Your teeth are super important, right? If you've had trouble with your teeth, you will understand that. And many people put a lot of money into their teeth, especially as they age, because you can't function without teeth. So doing this just for your teeth is really, really great, but it's also for other things. So found this in the National Library of Medicine. And this brings me to what I was going to be saying. When I look now, I'm like, okay, I've got information on my files on oil pulling, but I want to just, I just go into Google, but I don't Google, I DuckDuckGo, but it doesn't seem to make much difference whether you Google or DuckDuckGo these days. But you put in oil pulling and, just try that when you get a chance. And you're going to find WebMD, you're going to find Cleveland Clinic, you're going to find all these different things that are very mainstream. And they'll have a little blurb in there about something. They'll say, but the evidence is not, scientific evidence really doesn't back it up. But traditional things say. And this is really disgusting me because it used to be if you were looking, especially if I was looking for something that had to do a little bit more deeply than just like, say, maybe a generic term that anybody would be asking about, such as oil pulling. You would get on your first page, you'd have some of those, but you'd have some different ones too. You really have to go page after page after page to find more valuable information. I find these days, I don't know. I think other people have told me the same thing. You really have to be kind of careful that way. Okay, so my problem is when I'm doing this with the sharing, that's the problem. I cannot see if somebody wants to. Let's see how I do that. I've got to get this over here. Okay, and then let me just also go to chat. I have to just get that so. All right, cool. All right, now I can see everything I want to see. All right. Where there's a will, there's a way. Learn something every week. So I did find, in fact, I think I'm going to do that while I have you here, and you might be able to see it. Oil pulling for teeth. And looks like I've still got the thing. You can probably see that. So oil pulling, the benefits. Very Well Health. Very Well Health is a very common blasé website. Cleveland Clinic. Here we go. Benefits, how to do it. Oil pulling with coconut oil for the teeth, that kind of thing. Oil pulling, health line. Again, these are all things that you're going to see, right off the bat. And then Forbes, right? That's just where I go for that's probably, yeah. So anyway, and then I said, I'm going to go to more results. And I found this one I thought looked good. Gosh, where is it? Oh, look at this. Bad Science, oil pulling, the British Dental Journal, Nature. So anyway, I digress. But what I'm saying is, this is the one I found. This is what I look for, right? I look for ncbi.nlmnih.gov, right? Because that's going to be a study. And so you have to be careful. Be careful when you're looking online, because you'll get told this is really of no value, or it's of limited value, or don't, whatever. So there you have that. Now, I'm going to go back a page or two. Where was I? I wonder if I can get back to my page I had there that I was sharing. Let's see. Okay. I think we're all looking at the same page. I think we're all on the same page here. Just SWISH. So this was another one that I found, the National Library of Medicine. So this is the National Institutes of Health. Oil pulling and importance of tradition was published in there, right? Oil pulling and importance of traditional medicine and oral health maintenance. But see, it goes beyond that. Dental diseases have detrimental effects on the functionality and quality of life of individuals. In addition, a strong relationship has been established between various oral and systemic diseases. In fact, the prevention and treatment of dental caries and periodontal disease have been shown to reduce the risk of diabetes and heart disease significantly. This goes beyond the role of oral health as a means to identify early manifestations of systemic diseases in the oral cavity. It highlights the necessity of maintaining an optimal oral hygiene to significantly modify the risk factors for serious systemic diseases. The use of oil pulling can be frequently found in ancient medical texts and is supported by recent studies for its efficacy and long-term use for maintaining and improving oral health. This article, blah, blah, blah. And incorporating oil swishing as a component of daily oral hygiene can significantly improve oral and general health. Specifically in lower socioeconomic groups, which is basically they're saying it doesn't cost very much. Like going to your dentist costs a lot. And who have interrupted access to healthcare services and dental products, and such as dental freezes and mouthwashes, blah, 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 blah. So I'm going to stop my share for a little bit there. So this is great. It's so simple to do. You do it with stuff you probably have in your kitchen already. I use coconut oil. Coconut oil is not the only oil you can use. The original oil in India that they used to use more often that I've read is, sesame oil. Can also use sunflower oil, but I use coconut oil because that's what I have on hand in my kitchen, because we use it to cook and things like that. So anyway, how do we do this? So again, just bear with me for a moment. How do you do it? How you do it is really easy. You just take a spoon of oil and you put it in your mouth. Coconut oil is like hard at room temperature. It's solid. So I just start melting it, pushing it through my teeth, both sides. And then you just start swishing. And all your teeth, making sure you're getting all your teeth. And, and once in a while you'll stop and you'll just hold it in your mouth. And the oil, that works too when you're doing that, because the oil is actually being, it's the oil itself that's attracting bacteria and toxins to it. Oil, they want to adhere to it. So just being present in your mouth. So if you get tired of swishing, you can, just hold it in your mouth for a little bit, swish some more. Sometimes you get thinking about stuff. I get thinking about stuff and I forget to swish, and I'm just like walking around with coconut oil in my mouth, and that's beneficial too. But swish as much as you can. It's good for toning up the muscles in your face as well. So I'm going to go to this article first. It says here, oil pulling, a secret for optimal health. This is from Green Med Info. Green Med Info, I often mention, is a really fantastic resource if you're looking for anything, and you can find, they've got a database that just is off the map when it comes to finding information about anything. And they've got study after study after study. If you're looking for scientific studies that have to do with things that you would put into the natural health realm, it is, there's nothing like it out there. So let's see here. I'll share my screen again and click here. So there, Green Med Info. Sayer G is actually the founder, and this particular one was written by that man, but you can see the sesame oil there. And he says, oil pulling is an ancient Indian folk remedy. He's Indian, by the way. First mentioned in the early Ayurvedic text, the Sharaka Samhita, which was believed to have been written approximately 1,500 years ago. Yeah, I mean, they had to take care of their teeth, right, back then. You know how you feel? If you just go, you eat a meal or something and you don't brush your teeth, it just feels terrible. You've got to know ways to clean your teeth. One oil pulls by simply swishing a tablespoon of oil. Sesame, coconut, and sunflower are commonly recommended in one's mouth for approximately 15 to 20 minutes on an empty stomach, and then spitting it out. And you can go to a video there, right? So if you click there, this is the other thing I'm telling you about my newsletters. If you do that, you get how to do an oil pulling. What's really interesting about this particular one, though, is that I'm sorry I used that example because it looks like the video doesn't exist any longer. And the video was a Mercola document. But let me give you another example, a better one. So it says here, down here on this bullet point, right? Proven to exert antibacterial actions through emulsification and saponification. And if you hit that, you will hopefully get, okay, come on. Yeah, right. Oh, it tells you where to find that. And then there. Okay, thanks for not making me a liar. So see, you can go on and on. Oil pulling with sesame oil significantly reduces Streptococcus mutans in plaque and saliva of children. So yeah, all really, really good. So yeah, so anyway, modern scientific inquiry increasingly confirms oil pulling's benefit to oral health. You see that and that again. And proven to be as effective as the Oral-B mouthwash, the chlorhexidine, for chronic bad breath, but without the side effects. Proven to be beneficial in patients with gingivitis and can result in whiter teeth and pinker gums. I have to say, my teeth they look in the mirror to me like they're whiter. My teeth don't look like fake teeth white, and they shouldn't, but they seem whiter. And I wasn't really expecting, that really wasn't why I was doing it. I wasn't doing it for whitening. I was just doing it for health. But I noticed that they feel really, really clean too. I've had good dental health, so I've been blessed, and sometimes I can take it for granted, but you can just tell that you're doing it over time. Proven reduce the cavity-linked the Streptococcus mutans bacteria. We just saw that briefly, the abstract on that, in plaque and saliva of children, that's the mutans bacteria that can cause cavities. Proven to exert antibacterial actions through emulsification and saponification. Because oil pulling positively affects the composition of bacteria in the mouth by killing pathogenic microorganisms, it makes sense that it would be beneficially related to other health conditions. I've got my chat in the way there. Okay. When the gums or teeth are infected, bacterial cells and or their highly immunogenic components can more easily enter the blood, wreaking widespread inflammation. Insofar as oil pulling nips the bacteria-associated cascade of harmful inflammatory reactions in the blood, it may reduce the toxic load on the entire body. And that is really interesting. When I go to this really good article that I like, I'm going to skip around a little bit, this one. And it was this that I saw that I knew about oil pulling for quite some time. I've known about it for years, but I wasn't practicing it. And it was when this one came out in the Green Med Info, daily email feed or whatever, that I got back on to doing this. And again, it talks about this, blah, blah, blah. In Ayurveda, this is really cool. One of the major schools of traditional medicine, they say that oil pulling is highly therapeutic for over 30 systemic diseases. Over 30 systemic diseases. So they, in their medicine, they tout it as a panacea or a cure-all. This is huge. Again, like breathing, like bouncing. These are things that you can incorporate into your daily life. They don't cost money. I mean, yeah, you have to buy coconut oil, but a tablespoon a day to do all of this for your teeth and your gums and then your overall health, and just fit it into your day. It's very, 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 very cool. The simple technique. In Ayurvedic, okay. There are a number of studies. One study from the National Center of Biotechnology Information states that oil pulling activates salivary enzymes, which absorb toxins such as chemical toxins, bacterial toxins, and environmental toxins from the blood. Thus, oil pulling detoxifies and purifies the entire body. As it is swished around in your mouth, the lipids or the fatty acids in the oil naturally extract these potentially harmful substances from your teeth, gums, and salivary glands. In Ayurvedic medicine, the mouth is considered to be the mirror for the entire body. And when something is out of balance in the oral cavity, a Vedic healer will tell you there is most likely an illness brewing somewhere elsewhere in your system as well. I also need to get into the whole root canal problem, which we've talked about many times. I've mentioned it many times, never done a whole entire program on it, but this is root canals affect the health of the whole entire body. And that's because of the bacteria that stays disconnected from the immune system. And anyway, that would be something to go into. They talk about doing it here. I've told you how to do that. You spit it out into, you don't swallow it, right? Because you don't swallow all that stuff. You might want to eat some coconut oil, like for health purposes, but don't swallow the stuff you swish with. Swish and spit. And then you don't want to clog your drain, right? You don't use coconut oil, will harden, and it'll just sit in your drain hard. So you don't want to do that. Favorite oils to use. Okay. Now, stop the share for a moment. The there's an infographic on my newsletter there, benefits of oil pulling, everything you need to know about oil pulling. It says there are just so many benefits to oil pulling. Some of the other advantages that people and scientists have noticed are that it helps people sleep better, improves energy levels, and helps to reduce sinus problems. That makes sense too. We were talking a couple of weeks ago about colostrum and about the microbiome in that book I had read, the MMM theory. So the microbiome, mucosal milieu, and how I had read about using particular probiotics for the ear, nose, mouth, and throat. And those are probiotics that I've not seen in other probiotic strains that we use for other areas of the body, specifically the gastrointestinal tract, but even, probiotics are formulated for things like people with prostate issues or vaginal infections, those things. But there are specific ones for all of this. And so those are recommended for, people with sinus problems to get that microbiome straightened out up in the head, up in all of these tissues. So what exactly is oil pulling? Blah, blah, blah. Now this one, benefits of oil pulling. Now I have to laugh on this one. Share my screen again for a second. Here we go. Everything you need to know about, and I was kind of chuckled on this one because this is beauty and aging, right? So it's all geared towards that. The first thing they talk about is weight loss. And I'm like, weight loss? Whoa, wow, that's great. And then I read, when I was reading the whole thing, you read down at the bottom and it says, because you feel so good about yourself that you're less likely to eat chocolate. And I was like, well, I would not make that a direct connection. Would you? Would any of you? I don't think so. But nice try. We all know how weight loss will attract anybody to read something, right? This is good for try anything. This is good for your weight. But anyway, this is how does it work? Pulls, blah, blah, blah. We've talked about the financial benefits to your oral health. Obviously, it says, as mentioned, there were many in the ancient world that believed it would remove plaque and bacteria, and this is certainly the case. Research has shown that the bacteria cling to the oil, which improves your oral health instantly. This means that your teeth are protected from cavities and your gums are protected from gingivitis. On top of that, your gums, jaw, and teeth will be strengthened. Bacteria often destroys the muscles and framework in the mouth, and this tends to weaken all aspects. By getting rid of all potential issues, you will keep your teeth for longer. But it's also, the swishing is really good for your muscles in your face. Yeah, I mean, that's just really good for like a sort of a toning. While your teeth are cavity-free, the oil will help to whiten teeth. There are other natural ways to whiten teeth, but why worry about them when you can get so many other health benefits at the same time? Exactly. To me, the whiter teeth is like a side effect, like a side benny. Now look at this, curing hangovers, migraines, and toxin buildup. So the hangovers, those pesky hangovers, will be a thing of the past with oil. By swishing it around your mouth, you increase the number of nutrients your body gets, which will add them back in. Okay, you do get nutrients from oils, from helpful oils. Alcohol, it often makes it harder for the body to benefit from nutrients. This is kind of like the weight loss thing, though. It's kind of like a hard sell to me. Because of the buildup of toxins, the oil, whether it is coconut or even sunflower, will remove the toxins from the body. That's what I would think would be helpful with the hangover, right? Is getting the toxins out, not providing nutrients. Getting rid of the toxin buildup is beneficial in other ways. Toxins tend to lead to various health problems, including kidney and urinary stones, which are extremely painful. Can mean your organs don't work like they should. They can lead to more toxin buildup, becomes a vicious cycle. Removing toxins will remove health risks. It can even lower the possibility of having organs such as your gallbladder removed due to toxins deteriorating them so much. So again, getting to the rest of the body. Keeps your skin clear. If you have bad skin, you should start oil pulling today. This is a health benefit partially due to the removal of toxins. Your body can excrete some toxins through your skin, leaving it oily and full of acne. When you remove the toxins in other ways, your skin doesn't have to deal with the dirty work. It can be left looking luxurious. Okay, that won't do everything on its own, blah, 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 blah. Better sleep, blah, 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 treat bad breath, weight loss. Yeah, I wouldn't say that would be the thing for that. But if we go to the next, I thought this was really something that's important. 15 diseases caused by poor dental hygiene. Oral systemic health is a term to showcase the rising and increasingly important research-based links or connections between oral health and whole body health. Research has shown countless health issues caused by poor oral health. So I'm just going to start jumping through. Okay, Raymond asked me how long before I noticed any improvement. So I have really healthy teeth, and I did this to add on to my teeth. What did happen to my tooth, a tooth, was I had a broken tooth, which I believe is because I have extra wisdom teeth. That's why I'm so smart. And I believe they're kind of like moving. They're not exposed, but they're back here. And slowly my teeth were getting tighter. And I was always getting food caught between a couple of molars in the back, and always like getting food out of there. And then one day a piece of that tooth was gone. And I just ignored it for like 7 months until I developed an infection. And that was bad on my part, but I'm used to having healthy teeth. And I'm like, I'm just going to brush and use my water pick. But I didn't stop to think that teeth inside don't have enamel. So you don't have any protection there. So anyway, I developed a tooth infection and I had to have the tooth pulled. Well, they offered me a root canal. Don't ever get a root canal. Absolutely not. And they offered me a implant. No. I don't want any of this dental stuff in my mouth. And in fact, so what I'm getting is I'm getting a fake tooth. Like a little bridge, right? Just to put where that tooth is missing. So anyway, it was surrounding all of that in October that I started doing this. So I don't have anything that I was trying to necessarily treat with oil pulling, except just to enhance my dental health. And so I can't say how long it took me, but I would say I've been doing it a couple of months, and then I look in the mirror and I think my teeth look whiter than they used to. So I just didn't know if it helps with coffee stain or that kind of thing, or I don't know. Anyway, so you guys can try this and let me know what you think with your dental health, how long it takes you to notice improvement. But my teeth feel really, really good. Everything feels great. All right. So so getting here to the 15 conditions here that can be linked. And you can look at those later too. Diseases caused by poor dental hygiene, cardiovascular disease. Between 80 and 90% of heart disease can be prevented. Proper dental hygiene is just one way to lower risk for developing cardiovascular disease. Periodontal disease is directly linked to artery inflammation. Bacteria from the mouth enters the bloodstream, causing arteries to harden, which in turn increases a patient's risk for stroke or heart attack. Poor oral health is also related to high blood pressure and the dense LDL cholesterol, further increasing risk. How do you prevent gum disease by caring correctly for teeth and visiting? This page is not about oil pulling. This is about taking care of your teeth. And I think it's by a periodontal group here. So And, if you're a person like I have, a mitral valve prolapse, which is, a congenital, very common heart defect. I was, for many years, when I would go in for a dental cleaning, supposed to take antibiotics before you go in and then after. And that, again, is to prevent bacteria from traveling from the cleaning, from traveling to your heart and causing what they call endocarditis, right? So inflammation of the heart because of bacteria from the mouth. So just kind of extrapolate that into this whole idea of the oil pulling and just continually getting bacteria out and the things that can harbor bacteria, such as plaque and tartar. Alzheimer's disease. Poor oral health will cause inflamed gums. When bacteria leave the mouth and travel to the brain, they can kill brain cells, leading to memory loss. Oral bacteria from poor dental hygiene have been implicated in the development of Alzheimer's disease and dementia. Pathogenic oral bacteria called spirochetes have been studied as potential cause of Alzheimer's disease. The presence and frequency of spirochetes are significantly higher in Alzheimer's patients' brains than in controls. Salivary diagnostic testing can detect the presence of these oral pathogens. Diabetes, according to the American Diabetic Association, 37.3 million. Okay, we know that we have, a lot of people have diabetes, right? Periodontal disease makes it more difficult for the body to control blood sugar levels and can increase complications from diabetes or increase risk for developing diabetes. 95% of adults with diabetes also have periodontal disease. Wow, that's huge. 95% of adults with diabetes also have periodontal disease. So, okay, I would say that gives room for thought there. High-risk pregnancy. According to a study done by the British Medical Pregnancy and Childbirth, women who had periodontal disease were 6 times more likely to give birth prematurely than women with no periodontal disease. Bacteria, Fusobacterium nucleatum, present in the oral cavity, has been found in amniotic fluid, placenta, and chorioamniotic membranes of preterm birth infants. Wow. Obstructive sleep apnea. A lot of people have this. One of the first signs of obstructive sleep apnea is teeth grinding, a sign dentists and hygienists. I was going to read hypnotist, Raymond. Dentists and hypnotists should look for in all patients. Hygienists should look for in all patients. Grinding teeth can cause cavities or inflamed gums, increasing susceptibility to infection. Sleep apnea is then linked to high blood pressure, heart disease, and headaches. Collaborating with a medical and dental team can help, they say. Respiratory issues. Poor dental hygiene and its connection to a higher clinical risk. Its connection to a higher clinical risk for respiratory issues is not a new idea. Bacteria in the mouth can be inhaled into the lungs or travel through the bloodstream. That makes sense. Are you seeing a trend here? Once in the lungs, bacteria can lead to respiratory infections, bronchitis, pneumonia, COPD, and lung disease. So this is really interesting. It makes so much sense, doesn't it, when you think about it? It really does. I mean, just doing this today is making me all the more happy that I'm already oil pulling. And you guys should just all be doing it. Cancer. There's a strong correlation between periodontal disease and cancer. Pancreatic cancer, lung cancer, and blood cancer are just a few cancers people with poor oral health have been studied to show higher risk. And then rheumatoid arthritis. Johns Hopkins studied the link between poor oral health and rheumatoid arthritis. Results showed a correlation between the bacteria. Oh, great. This is like worse than super. Okay. Aggregator bacter acidomyosinum and periodontal disease. The inflammation inflammatory response of joints in patients with rheumatoid arthritis is similar to the inflammatory response in the patient's mouth with periodontal disease. Okay, wow. Osteoporosis. Later stages of periodontal disease can cause a loss of bone tissue from inflammation and infection. Okay, that's like right up in here. Clinical studies uncover links that periodontal disease affects bones throughout the body, not just the jawbone and teeth. Okay, I said, okay, that's up here. No, they said different. Research shows other things too can create to that. Oh, estrogen deficiency, low mineral bone density, and low vitamin D levels in both osteoporosis and periodontal disease. Okay, so some lap over there between these other things like estrogen problems, bone mineral density, low vitamin D levels, and periodontal disease. Kidney disease. Poor oral health leads to inflammation and infection that will travel throughout the bloodstream, making it more difficult for the body to fight off infections. Kidney disease can lead to cardiovascular disease and other consequence of poor oral health. Prostate is number 11, and erectile dysfunction. Can poor oral health affect your sex life? The answer is yes, this paper claims. Periodontal disease opens pockets for infection in the mouth. Bacteria and infection in the bloodstream can cause inflamed blood vessels, blocking blood flow to the genitals. One study showed that men with periodontal disease were 3 times more likely to experience erectile dysfunction than men with a healthy oral cavity. I can honestly tell you, I've never known that. And for all the guys who ask me about that, I've never, ever thought to mention it because I didn't know. Well, you can't mention something you don't know. Right? That's so interesting. Periodontal disease, periodontal disease itself is a big problem. About half of all Americans have some form of periodontal disease, which continues to increase each year. Periodontal disease decreases your ability to fight infection and inflammation while increasing your risk of severe systemic health consequences. Few people understand the risk factors for developing periodontal diseases and the consequences periodontal disease has on systemic health. Periodontal means around the tooth. Periodontal disease, also known as gum disease, results from infections and inflammation in the mouth. They say information, but that's a typo, or AI. When the mouth and teeth are not adequately cared for, bacteria infects the tissue, creating inflammation in the mouth. So the oil pulling, right? That's how you take care of the bacteria and all of that in the mouth. Now, they even say obesity. They got to bring weight in here. Number 13. Obesity and oral health both share common risk factors. Diet plays a significant role in oral health. Well, without a proper diet, oral health is at risk, and therefore overall health is at stake. Well, of course. While the causes of obesity can range from genetics to cultural factors, maintaining a healthy weight is essential in optimizing oral health. Now, this is very interesting. Number 14 they have here is COVID-19. It's well known that systemic inflammation is linked to periodontal disease and respiratory diseases. COVID-19 is known to trigger an inflammatory response. In a Journal of Clinical Periodontology study, patients with periodontitis, the most severe stage of periodontal disease, were 3 times more likely to experience severe COVID complications, ventilation, or death. Okay, so saying that bacterial load in the person with the periodontal disease in their mouth made them weaker when it came to COVID-19. And then infertility. Poor oral health can affect fertility. It can take longer for a woman with poor oral health to conceive than a woman with good oral health. This doesn't end with women. Studies have shown that men with poor oral health can have lower sperm count and reduced sperm motility. Wow. Okay, so all of that stuff. Really good reasons to be taking care of our teeth. I wanted to go up into, let me share my screen one more time. And I think I think it was in, this one that he talks about. Yeah. Now, Sayer G, this is going back to the article I spoke about at the very start. And Sayer G says here, one common cause of the ongoing bacteria-mediated inflammation is the presence of a root canal. There are many reasons to avoid root canals, and a common sense, put my chat back up there, and common sense would dictate keeping a dead piece of your body attached to a living tissue is a bad idea. But millions undergo this procedure under the advice of their dentist or endodontic specialist without fully being informed of the deleterious health consequences. The reality is that there are miles of maze-like microtubules within the dead tooth, a perfect breeding ground for anaerobic oral microorganisms that secrete potent endotoxins. It is simply impossible to completely fill these voids with dental compounds. So if you don't know what a root canal is, right, that's what they do. They take out the dead part, they take out the infected part of the tooth and they fill it all up, the pulp area and everything. And they think they're filling it all up, but it's impossible to fill them all with the dental compounds. Case in point, a 1998 study published in the journal Annals, and it should be Annals, not Annuals, of Periodontology titled Anaerobic Bacteremia and Fungemia, fungus, in patients undergoing endodontic therapy. An overview found that endodontic therapy, i.e. root canal, is associated with high rates of infection, up to 54%, with anaerobic bacteria. More recent research confirms this finding. A 2005 study in the Journal of Dentistry also found detection of bacteremias during non-surgical root canal treatment. Unfortunately, root canals lead to the secretion of endotoxins directly into the blood. And while oil pulling may reduce some of the fallout from having an infected tooth, it will not resolve the underlying issue. Often, removal of the canal tooth is the only permanent solution. The good news is that oil pulling is easy to perform intervention with a high margin of safety. Many report significant mitigation of seemingly unrelated health issues following its regular practice. Often the best proof is firsthand experience. Give it a try, and please report your experiences below in the comments section. But yeah, so that is, you do, if you have had root canals, still oil pull. And oil pull, so you don't need more root canals, and oil pull to remove things that might have bacteria that might have surfaced. The problem is that the bacteria gets into the bloodstream, sort of through a direct conduit through that canal, and that is the danger. So have had many people say, "Well, I've got to get the root canal." I warn them about the root canal, and they're like, well, I can't afford to lose another tooth. I can't do that. And I understand those difficulties, but I'm telling you, you really are putting your systemic health at great risk by having root canals done. And there is actually, I have in my files, I think I can just go there and show you if I go to my health files and I go to dental health. And then root canal dangers, root canal cover-up. Root canal dangers is probably not going to show up in my share unless I stop and start again. So I think, is there anything to help those of us who have already had root canals? I don't think so. I don't think so. Not that you can do in the mouth like that. And I'll tell you what happened was beyond getting, the only real remedy is to have the root canal removed. And that's what Weston A. Price, remember I've talked about him many times. I think you should be seeing this. It looks like it's got the green box around it. Okay. Root canal hazard. DNA studies confirmed Dr. Weston Price's century-old findings. The toxicity of root canals was disclosed by his Mayo Clinic and Dr. Weston Mayo Clinics and Dr. Weston Price jointly back in about 1910, close to a century ago. Price's textbook on root canals, published in 1922, upset the dental associations at that time and still does today. The American Dental Association, the ADA, denies his findings and claims that, excuse me, they have proven, that they have proven root canals to be safe. However, no published data from the ADA is available to confirm this statements, but no actual research. My attention was drawn to the increase in autoimmune disease after the high copper amalgams of 1975 were initiated as state-of-the-art fillings, which the ADA claimed to release no mercury. On the contrary, studies from Europe found that the high copper amalgams release 50 times more mercury than previous amalgam. Okay, and then in watching these changes regarding the onset of autoimmune disease, I noticed a blip in the statistics, an increase in ALS, blah, 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 blah. Anyway, yeah, we'll talk about this in more depth. Maybe do that next week or another time, but I will also include this information so that you can see it. And Karen, I can definitely send it to you because I have your email. I have everybody's email, really, who's here. In mercury, blah, 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 root canal. Okay, it talks about the mercury and all of that. Price was concerned about the pathological bacteria found in nearly all root canal teeth of that time. He was able to transfer diseases harbored by humans from their extracted root canal teeth into rabbits by inserting a fragment of a root canal root under the skin in the belly area of a test rabbit. He found that root canal fragments from a person who had suffered a heart attack, when implanted into a rabbit, would cause a heart attack in the rabbit within a few weeks. Transference of heart disease could be accomplished 100% of the time. That means every time he did that, the rabbit died of a heart attack. I remember reading that somewhere else. Every single time. Some diseases transferred only 88% of the time, but the handwriting was on the wall. Dr. Price discovered that root canals had within them bacteria capable of producing many diseases. They had no place in the body. Which is more important, the life of the tooth or the life of the patient? This is still the primary argument facing us today. And then goes on to talk about root canals and neurological disease. Considering the difficulty of culturing anaerobic bacteria, it was hard to identify them with 1920s technology. Most of the bacteria reported by organized dentistry at that time were aerobes of unknown significance. Today, with DNA analysis available, anaerobic bacteria, the dangerous kind, can be identified whether dead or alive by the presence of their telltale DNA signatures. Let's go back to the graph of ALS up through the year 2000. Whoops. Okay, ALS death rate to the year 2000 here. Note an increase in 1976 and another increase in slope in 1991. In 1990, the Dental Association suggested that dentists perform 30 million root canals per year by the year 2000. Dentists accomplished that goal by 1999. As I understand it, the bar has now been raised to 60 million per year. Oh, this is how many you're supposed to do. The unexplained increase in MS coincided with the advent of high copper amalgams. The increase in ALS in the same year is suggestive of the same cause. ALS also increased in 1991 as more root canals were performed. Statistical coincidence? The goal of dentistry is to save teeth. Root canals allow dentists to maintain many teeth for years instead of extracting them. But is this goal appropriate considering the biological expense exposed with DNA research? What is more important, to save the life of the tooth or that of the patient? Havens for bacteria. Dr. Price, while head of the research for the now defunct National Dental Association, took 1,000 extracted teeth and reamed them out as dentists normally do prior to filling the canals with wax. Price sterilized the canals with 40 different chemicals far too toxic to be used in a live human situation. He wanted to see whether the canals could be permanently sterilized. After 48 hours, each tooth was broken apart and cultured for the presence of bacteria. 991 out of 1,000 cultured toxic bacteria just 2 days after treatment with chemicals designed to make the tooth sterile. Where did these bacteria come from? An overlay of the structure of the tooth, you can see all of that. This is the whole thing. It's a lot more complicated than what's going on there and the bacteria than simply, oh, we'll take out the infected portion and we'll put something else in there and we'll be fine and you'll be just fine. It was very interesting because when this happened with my tooth broke, and my dentist knows what I do and everything. And she wasn't at all surprised when she said, we can do a root canal. And I was like, absolutely not. And she got that. Or we can put in, some cadaver bone and do a bone graft, no. Just give me a fake tooth. Just give me a fake tooth. I know how to keep my other teeth healthy. But I won't miss it. Right. This is what is done, and people aren't aware of the risks. Lisa says, thank you for bringing this information to my attention, as I had no idea of the dangers in undergoing a root canal procedure. It is what you don't know about your health that can harm you or kill you. Yeah, it's so true. And when it comes to this, what about when they do permanent implants? I read that wasn't good either. Is that true? I don't know. I'd have to look into it. I don't like any of that chemical in my mouth. I had to go in last week to get molds done, impressions done, to get this fake tooth. Oh, as soon as I was done, they put that composite in your mouth. Of course, it's loaded with chemicals, right? I don't know what kind of chemicals or what, but anyway, I went straight home and I oil pulled for another 20 minutes. I had already oil pulled that morning. Then I went home and I just oil pulled to get anything that was there, spit it out. I don't like stuff they put in your body or in your mouth that we don't know. Oh, gee, we didn't know that then. And then you find out later on, oh, too bad. But people do recover from, I will say this, and this is very key. Weston A. Price would see where he would remove root canaled teeth. He would remove the root canal and people would get up out of their wheelchairs. Their illness would be cured. So that right there is huge. He talks about one where he took the root canal out of this one woman who was wheelchair bound, and he sewed it into the belly under the skin of the rabbit. The rabbit developed the exact same symptomatology that this woman had who was wheelchair bound, and she was able to walk. She was freed of the disease. So I will tell you, if you have had root canals and you have disease, that you have a chronic illness, something like this, that's really setting you back. I would, if it were me, I would just get that taken out. That would be my recommendation. But anyway, I don't know about the permanent implants, but that'd be something I certainly will look into. And if I find, I'm sure there's answers easy out there. We can briefly touch on that next time. But I don't like, I just don't like all that fake stuff. And, dentistry is big money. Those of you who put money into your teeth well know. So, in any case, that brings us to the end of our program. It is after 1 o'clock. I want to thank you all for being here, and hope you'll join me again next week. I'm not exactly sure what my main topic will be. I get to have the fun of figuring that out. And if you ever have topics that you want me to address, just email me. You guys all have my email. You know how to reach me. Say, I'd love it if you do a program on this, or will you talk about that? That would be really great. And thanks, Melanie. Said I missed part. We'll come back and see it all. And again, I'll have these videos from last week, Just Bounce, and from this week, Just Swish will be up on video later this afternoon. I'll let you all know when they are available. So thanks again. Have a wonderful weekend, a wonderful week coming up, and go to health.